Hello, this is Grace. I've been doing a series on what to expect during surgery. I've done two parts of the preoperative phase, and I don't particularly work in the OR, but I know what happens there. So I think it will not be fair just cutting that out. It's all I think it's only fair that I give a brief summary of what the patient should expect when they are in the OR room. So I'll start from the latter part of the preoperative phase after the consent is signed and the doctor, the surgeon, and their team, including the anesthesiologist, has already seen the patient. The nurse and the OR team will verify all that information gathered about you, the patient. Consent is very critical. Without consent, no matter what is done in the preoperative phase, we cannot move you forward through that phase to the OR room. So the OR nurse and the pre-op nurse, verify that whatever you signed for is what is going to be done. Prior to this, they already have prepared for you in the OR room. They know you are coming. They know what type of procedure you are having done. Tables are turned and the stretcher is turned a certain way based on positioning. So there's a whole lot of detail that goes into getting ready for you. So you are actually very special. So once everything is done, is checked off and is verified, the OR nurse, and usually is the anesthesiologist or the anesthetist who works with anesthesia, takes you, the patient, to the OR room. Then you are out of the pre-op phase. So what to expect when you are in the OR room? There'll be quite a few people in the room that might surprise you. Don't be alarmed. Most people who work in the OR do not need to see you, such as the surgical techs. They are integral part of the process. They do not need to see you. Only the surgeon team, anesthesia team, and the OR nurse sees you. But in the room, you'll find all these people in the room, including students who are sometimes there to observe, or reps, equipment reps who are there to assist the doctor in choosing the right equipments to use for you, especially if it's something that is being implanted in your body. So by the time you get there, everything will be all set and ready to go. One critical thing that needs to be done is what we call a timeout. They will make sure and repeat everything that needs to be done, especially the side of your surgical part. If you're having a surgery, left and right is critical in the OR. Extremely necessary, extremely important. So for example, if you're having something done on your left toe, it has to stay left on your consent. So everything is all set and verified in the OR before the doctor even makes the first cut. So anesthesia will do their thing. The surgical techs will do their thing. The OR nurse is there circulating, doing their thing. Circulating just means getting stuff for the team because they are all sterile. They cannot touch things that are not sterile. So that is all I can tell you about what to expect in the OR room. You will not be aware of all these by then because you'll be under sedation. But when you get to the room, expect to see more people than you actually expect. Don't be alarmed. They are all there for you. You are the star of the show. So I'll follow this with the recovery area, and thank you. Thank you very much for listening.